I would like to give a very warm welcome to my presentation from the University of Lisbon, Portugal. The topic I will present is transcranial pulsatility index and intima media thickness correlation with the CD4-CD8 ratio in HIV patients. This work was carried out in the departments of internal medicine and infectious diseases of the Hospital of St. Maria, with special technical support from the Laboratory of Cerebral Hemodynamics, headed by Professor Vitor Oliveira, to which we are very grateful. HIV infection is a chronic disease which an increasing life expectancy while keeping the state of persistent inflammation with immune activation, so called inflammaging, and a predisposition for complications not directed to the infection. A few studies suggested that CD4-CD8 ratio was a possible accurate marker to predict future non-AIDS events, such as those associated with cardiovascular manifestations, namely ischemic stroke. The CD4-CD8 ratio can distinguish, so we can say that it can distinguish people living with HIV, requiring more aggressive control of modifiable risk factors in the prevention of early ischemic stroke, particularly when it remains inferior to 0.4. In this study, we intended to correlate the very low CD4-CD8 ratios, so inferior to 0.4, despite antiretroviral therapy, with neurovascular ultrasound parameters from transcranial Doppler pulsatility index and carotid intima media thickness. 79 men living with HIV under the age of 65 and under antiretroviral therapy for more than 2 years, with no history of cardiovascular events, were selected by convenience sampling from our immunodeficiency hospital clinic during the year of 2019. Possible associations were statistically thought using linear regression models and controlling additional risk variables and non-linear regression models by branches. We investigated on the data obtained from carotid ultrasound and transcranial Doppler examinations. Sequential CD4-CD8 ratios were calculated by lymphocyte subpopulations counts during the previous 5-year period. Two groups were established as according to the ratios as very low, inferior to 0.4, and immunologically normal, superior to 1. Only 49 individuals underwent carotid ultrasound and transcranial Doppler evaluation, and overall, the CD4-CD8 ratios showed a trend to stabilization during the previous 5 years. No association between carotid intima media thickness and with the CD4-CD8 ratios was found to be statistically significant. But The ratio shows, this ratio shows a negative impact of minus 0.10 over pulsatility index with a p inferior to 0.05. Additionally, the adjustment of a nonlinear model shows that the impact of CD4-CD8 ratios over the pulsatility index is more significant for ratios below 0.4, with an impact of pulsatility index of minus 0.19 with a p inferior to 0.05. To conclude, we can say that the association between lower CD4-CD8 ratio and higher pulsatility index on transcranial Doppler suggests an increased cardiovascular risk, possibly caused by the persistence of the immune dysfunction. Because this dysfunction causes predominantly inflammation, so atherosclerosis may present as less important. This may explain this association with pulsatility index values, but not seen in carotid intima media thickness. And a larger sample may be necessary to confirm our findings. Thank you very much for your attention.